Well, so my topic is basically offline theory examination in the new normal phase. Actually, we shall be discussing it on three different, on three different aspects. One, the first one probably would be when the students are actually, before they go to the examination hall. And what will happen inside the examination hall, and lastly, when they come out of the examination hall, what should happen? Then we have some questions which I would like to talk about. What are the innovations we can actually make? Because this is something which is happening for the first time, and we need to actually innovate a lot of things. So before reaching the examination hall, we have to ensure all these things which all of us know. Everybody should be wearing masks and wearing them properly. We can have a self-declaration by the students that they are not COVID positive and they are not suffering from any signs, symptoms of flu-like disease or COVID. Thermal screening at all the points should be done. Maybe better if it can be done at 2 points. One before they enter the building, and maybe one before they enter the examination hall. At all times, they need to follow social distancing. Books, bags, and mobiles should not be allowed into the examination hall at all. If possible, not even into the building. People should be carrying their own water bottle and stationery, because we should discourage sharing of water bottles or maybe even stationery like pen, pencil, etc. inside the examination hall. And it will be good if water will not be served in the examination hall. So people should be asked to bring their own water bottles and keep them along with them. Everyone, all the candidates must have Arogya Setu app downloaded and activated. Students ideally should be escorted in batches to the examination hall. They should not all go and stand in front of the examination hall to be taken. Rather, they should be taken or rather escorted in small groups, small batches. Now, inside the examination hall, only asymptomatic staff should be performing duties, and they should have face mask and face cover. The seating arrangement should be such that should be enough social distancing. I'll come to that again. Availability of sanitizers everywhere. Wherever possible, we must have enough of sanitizers. And no eatables should be allowed into the examination hall. Very often, sometimes they allow some coffee, etc. Nothing should be allowed into the examination hall. When it comes to distribution and collection of answer sheets, this is really very important, which many of us would actually miss while practicing. The invigilators should sanitize their hands before distributing papers. This is a very important point, a checkpoint. The students should sanitize their hands before receiving and handing back the answer sheets. Invigilators must sanitize hands before collection of the answer sheets and also before packing them. The answer sheets should preferably be opened after 72 hours. If you can keep it somewhere, just store it somewhere and not handle it for 72 hours, really it will make us little safer. And the record of all the staff who are working should be maintained, and also who is doing what job, that also should be recorded, so that if you have to do a contact tracing at some point somewhere, it can be done easily. Now, dispersal of the candidates after they have finished the examination. Gagandeep madam suggested a very important thing, which I think, yes, it's very, very important, that the students should be allowed to leave row-wise, one row at a time, so that they don't crowd, all of them don't get up and start moving like we find in aircrafts. Everybody stands up and starts rushing towards the gate, pushing each other. We shouldn't be allowing that. Also, students should not be allowed to stand in groups and discuss how the paper examination was and what were the questions, there were difficult, easy and things after the examinations, nor do this before the examination. This should not be actually doing group discussions and talking about the examination or the questions, etc. This should be actually discouraged, because we're going to very strictly follow social distancing norms. There may be some special situations where we need to actually probably make our own innovations at many places. Now, suppose there is a symptomatic candidate and who insists on appearing. We cannot refuse that candidate. So, such a candidate must be kept in an isolated room, a separate room, and permission to allow that candidate should be taken from the conducting authority, the university, or the conducting college, whoever it is. Now, this separate room should be airy, should have large windows, which ideally should be opened. Candidate can be at one end and the invigilator at the other end, preferably. If possible, there can be a partition of a transparent screen also in between, if it can be done. One invigilator, if there is only one candidate, one invigilator is enough, who should be actually adhering to all those PPE norms, personal protection, and there should not be a breach of protection during any time while he is there inside the room as an invigilator. Also, sometimes we can also innovate in a manner that like the invigilator stays outside the room, but the candidate is monitored through CCTV. If you have a good CCTV and good monitoring, it can be done, but this should be told to the candidate that he is being monitored, he is being watched, and actually the person who is responsible for monitoring should monitor that candidate regularly, because otherwise that candidate might sometimes say that there was nobody inside the hall and I raised my hand 5 times for extra answer sheet and this and that, nobody came to me, so I could not complete these questions. So we should not be allowing that. If we are monitoring outside, we need to tell the candidate also that, see, we are monitoring you outside, you are closely being watched. If you need anything, just raise your hand, we'll see you and attend to you. Now for this, a clear policy should be in place with all the SOPs. Like, if such a candidate is there, what do we do, so that there is no confusion at that time and everybody follows the norms. This can be done when we have our board of examination meetings, where we decide how the examination will be conducted. There we can lay down this policy also. Seating arrangement, we need to have at least 6 feet gap between two candidates. The desks of 2 candidates, there should be actually a 6-foot gap. No 2 candidates should be closer than one another than 6 feet. Now, for this we may require multiple halls, and in many places we do not have big halls, multiple big halls to conduct examinations where there are 250, 300 or 200 students. So we can even use small rooms or small halls, but the spacing has to be there. This 6 feet gap has to be there between candidates. So now you may ask me, well, it will require so many more invigilators. Yes, it will require many more invigilators, but in case we are actually having a dearth of invigilators, so we can have a little less number of invigilators in each room, so that we can distribute them in different multiple rooms. Here also we can take advantage of CCTV and have a central monitoring also, if we want to be very strict with this examination. West Bengal, I came to know, is already doing this picture which I am showing. I was told by some of my colleagues in West Bengal that they are following this in some medical colleges. The seating arrangement, as I told you, has to be like 6 feet apart, and some innovations like this can be done, as you can see in this picture. This hand-drawn pictures by me. there can be a wire frame with a cellophane sheet attached to it, which can be tied to the legs of the table or nailed to the table in some manner, or just stuck to the table with tape, with brown tape. It can be done. So if that can be done, then we will restrict a lot of spread of aerosols if somebody coughs or sneezes or something like that. So this will be a very good protective innovation. But then at the same time, the more things we have in the examination hall, the more we need to attend to them in terms of sanitization, etc. So we need to sanitize the cellophane papers also and see if there are tears, things like that. So we need to again repair them. But it will be a very cost-effective thing. Which when I was told about this, that in West Bengal, some people are doing it, I was like thrilled. I said, this is a very cost-effective, very inexpensive kind of a thing, which actually can be done almost everywhere. You can make your own innovations, so that every candidate is at least 6 feet apart, and whatever protective measures you can take, you can innovate also. Many colleges, many places are already practicing contactless methods. The students will fill up the forms and registration of candidates, etc. online. So there will be a contactless practice here. Even QR codes can be used for verification of candidates, etc., where you really don't have to touch the papers or collect papers. Now, suppose frisking is needed in the examination hall. Then the person who is going to frisk the candidate should use triple layer mask, face cover, and gloves, which is optional because gloves will actually make things a little more clumsy. We may not be able to find out. So that is again optional. May or may not use gloves. But yes, face cover and a triple layer mask at least has to be used. And this frisking part in the entire examination should be done by one individual, preferably, who should take all care that he has done the frisking of all the candidates. So in case there is a symptomatic candidate later on or somebody turns COVID positive, this single person can be isolated and contact tracing can be easier. We can even have a committee in the university itself or the college or the examination center. There can be a central committee which will actually be taking rounds to see what are the gaps, whether everything is being followed meticulously or not, or if there are some gaps. And they can even use a kind of a checklist to see, to identify these gaps, so that there can be remedial measures in the next day of examination or the next examination when we have, and then more of innovations actually can come in. So I think during this time we need to actually innovate more than actually adhere to regular normal practices. So I think I'm going to end here.
Thank you, Dr. Sanjay.
Thank you.
So
I'll just
we will take
sharing
all the questions at the end. Right. And I now invite Dr. Satyajit Saha to talk about practical assessments. So he's going to focus on conducting exams for phase 1 and phase 2. So Dr. Saha.
Yes, madam.
Yes, to Dr. Saha.
Yeah, thank you, sir. Okay. So a warm welcome to all of you. We are on this MESI platform conducting today's webinar on the assessment in the new normal phase. I am majorly going to talk about the practical exams because this has been a very important point, that it has been a very important concern. As sir has already told, we had found out that there are ways to maintain that gap, that means the social distancing, how to understand or how to maintain surface non-touching techniques, but those are majorly for the theory exam. So in the practical examinations, it has been a major concern how to So this entire PPT will actually be divided into majorly two parts. So as we progress, we will understand this. Okay. So what is the basic need for the practical exams when it is done in the med school? So we know there are basically the three principles. So number one is whether the student has understood and learned the basic principles, and whether they have understood attended the requisite skills, and finally to certify. These are the basic principles. So this is a very common theme. We are definitely going to talk about this particular techniques of histology, this one that is microscopical. So this is a very common scene which is seen with respect to anatomy, physiology, pathology, microbiology at times. So, but what next? Generally, what happens after next is this key. These are the different things that can be seen under the microscope and they can be talked about. So, to follow the basic idea, we should actually be concentrating on these parts. The principle should be that the student is able to handle the light microscope and use the optics to focus, thereby addressing the basic principles. And whether the student is able to focus and identify the microscopical slide, histological side, or the histopathological slide. And finally, based on these two, the certification is done. Now, a very important question arises: is this the only protocol that is followed? Because when we were thinking about this, understanding how to address the problem during the practical examination, that's what came into our mind. Do we really do certification in that way, or this is a more common scenario where during the examination of the practical scenario, these are different types of questions that are asked. So we are not exactly looking towards the skill of the individual. We are looking more towards the portions which are the cognitive domains. Now, in the practical examination, definitely we should also talk about the cognitive domain, because it's a part of the Miller's pyramid that they are able to make the person understand, make the examiner understand if they have got a better understanding of the thing. They have understood the whole thing and they're coming to a conclusion. But what generally happens is we are majorly ending up addressing the cognitive domain. So when we are doing the practical examination, first we need to understand the student is appearing in a practical examination for understanding the skills part, and cognitive domain can be done in some different. So why are we wondering over this? Because definitely because of this COVID scenario where we have been thrown this question, how to address this particular problem of maintenance of the social distancing and everything. So as we know, necessity is the mother of invention and everything. So we are going to undergo into an online method of assessment. So from the entirety of the offline assessment, we will have to somehow move a portion of it into the online platforms. It's just a suggestion. So in the very beginning, what we need to understand is what are the different aspects of the practical examinations that are being addressed. So if it is cognition, then address it in a way. If it is skill, address it in a different way. Keeping that thing in mind, we saw this thing, there is possibility. But during this problem of the COVID, social distancing is absolutely nowhere between the students. Even when we're doing it in the classrooms, like just for the semester purpose, there where this social distancing was not being maintained very properly. So we can definitely do something, but what we can, that's what is the entire idea of it. So we have to, we really don't have an existing plan for it, but we can really think about it. So firstly, we must plan what to conduct, rather what we should be conducting on how much on the online and how much on the offline. Now, there would always be this question regarding which is better, whether online is better or offline is better. That inherent fight has come in the last 1 year. So it's better if we make a platter of it. Of all these veggies and fruits, you can see that all of them are actually very good. But how do we take it? We don't take one thing individually, but we rather prefer to take it in a platter. So you must keep this thing in mind that neither of either the entire online or the entire offline, neither is completely good or completely well. So there has to be a mix and a match, number one. social distancing, most students to appear simultaneously, and the standardization procedures that we intend to follow keep aside the biasness and everything. So, how to rather conduct this particular portion of online? So first we're going to talk about the different types where we can say offline studio we can take down. So one of the method is we can go for a direct streaming, number two is we can go for a Google form based, and number three is we can go for an in-house coaching. Just let me go into a bit detail. So in case of when we're trying to do it on a direct 1:1, it is something like what we're doing now. We can either go for a Google Meet, we can go for Microsoft Team, or we can also use this platform to have a 1:1 interaction with our students, where we are sharing the screen, we are showing them something, and we are asking them the questions. You identify what is this, identify point number A, point number C, point number D. So from that, I am getting a direct feedback from it. I'm getting the direct answer. So this is one way of doing it on a live streaming platform. Number two is it can be turned into a Google form where we take a particular snap, we put it in the Google form, and then we ask a question related to it. Now, why do we do it a Google form? What we personally felt is there is one problem with the Google form is that the answer that they are writing, that has to be very much standardized. Supposedly, if I am telling you this is a slide of a scheme, so the student might write SKIN all in cap, only S in cap, then KIN in small, like this. So we would have to put all of those as a part of the answer key if we are really eager to give them the feedback right then, or else we can just take the answer and do this checking all by ourselves. So as another problem for this Google form is this maintenance of the hard copy is a bit difficult, because eventually it becomes like we'll have to take the printout of all the students' answers, and then we will have to do it. So it becomes not that computer friendly and a bit simple, but yet very effective is if we are going for in-house projection. Now, in case of an in-house projection, we are calling all the students, a group that is supposed to appear on a particular day, say 50 students in a group, what we did. So they were asked to come inside the lecture theater with a capacity of 250, so social distances were met. Number two, things were then projected onto the screen like this. So this was the general idea given about the exam, what will happen. And then this particular slide was shown. And then the students were asked to write it in a piece of page. They were given that page. So they did write it. And at the end of the exam, what happened is those were collected from them. One of the advantage of this was that maintenance of the hard copy of the answer script becomes very easy, and definitely we can do all those like collecting the paper after sanitization, also sanitization of the, like those things has to be definitely maintained. So after that we can do, and we can always go for a handwritten or a handwritten answer script, and then we can check it. So these are basically the pros and the cons of the various methods that can be used. So for a direct streaming, one of the major problems that we found was it is going to be very much time consuming. There will be very difficult in maintaining this, because for direct streaming there must be dedicated IT notes in the department for the students to appear. For the examiners, they can use their phone or whatever, but for the student, because the student will come in the department, and from the department they are going to appear for this. So that particular PC with a video, with an audio, that entire setup has to be there with an uninterrupted internet connectivity. So that becomes a very difficult issue. Number two is if you're doing it in Google Form based, it seems that it's a very good and effective way to do, because standardization can be done, no biasness, and definitely on the day of the examination, when we are able to send all the questions at one single go to all the 50 students, it definitely saves a lot of time. It basically reduces the time exponentially. So, but then one of the major problems with the Google form is it needs a certain amount of expertise to complete it. The form and coordination between the teachers has to be, like between your external and the internal, has to be extensive. Otherwise, there are chances that question repetition will be there. So to address that, it has to be There has to be a very good coordination between the teachers. And lastly, this in-house projection that we practice, this showed there are only one particular criteria is needed for this. That is, the teacher must be able to create a PPT. Now, I think nowadays all of us with extensive audiovisual ideas and taking classes to audiovisual media, all of us know how to do this. And we can always, if you are using it, then it becomes, compared to the rest of it becomes a much easier process to conduct, even in those places where the number of faculties are actually less. So with one particular set of question is used on one day, second set is used on second day. So like this thing can be progressed upon. So, but one problem will be that obtaining those soft copies of all the slides, instruments, charts, etc. So before the exam starts, this is one particular point which the teacher must be able to address, that all the soft copies are with them. Now that is also the case in all the three. Like if you want to do it on an online platform, definitely soft copies of those things that we want to share must be on the PC or whatever device we have. Now this is actually a plan where we can think about how to plan it on online and offline. Just divide it. So we can say that histology, spotting, cross section, radiology, bone, which is basically OSPI based Google Forms, and viscera like OSPI based Google Forms, they can be done online. And the rest of this, like histology, facial slide, here we can also understand and also will be able to certify that the student is able to handle the microscope and focus it. So we can do it here. ID, windows, bones, anatomical positions and ID of the various parts, and viscera, anatomical position, ID of the different parts must be done offline. There are no questions asked about that. Surface marking is a question which a lot of people had told it can be done online or it can be done offline. So more discussion on this will be preferred. When we're talking about physiology, similarly, then topics like instruments, interpretation of the ECG, spirometry, and parts of the muscle tonicity, they can be done. That means we're talking about a major portion of the grant fiber that can be done online, either Google Form based or 1:1 streaming based. And the rest of the every examination that we are talking about, metallurgical examinations and human experimentations, they should be done online. Biochemistry, definitely only one problem is with biochemistry that they do not really have so much of cognitive domain to answer. Their major cognitive domain is only on the grant fiber, but the rest of it is colorimetry and estimations of different things in the urine and identification of the unknown ingredients. So again, it's those tests that the students have to conduct. So there has to be done the method. So that is again an offline method that is suggested. For pathology, again for PBLs, spotting instruments, spotting of histopathology slides, and spotting of the specimens can be done on online method. Whereas peripheral ward smear, all the urine tests, estimation of ESRT, LCPB, IHB, and this one, that is exercise on any type of HP slide, has to be done on offline. That's suggested. For pharmacology, again, anything that comes under the domain of the grant fiber, including the charts, graphs, instruments, criticism of the prescription, therapeutic problems, drug-drug interactions, they can be done on offline method. On online method. Whereas pharmacy, if it is still being practiced, then it should be, preferably should be done on the offline method, similar with that of the prescription writing. And on microbiology, spotting and fiber can be done on online platform, whereas Raum staining or the biochemical reactions, serological testings, and the line smear of the stool examination, those have to be done on online or on offline platforms. And lastly, for the FMT portion, again, spotting, specimen models, X-rays, method poison, and viper, they should be done on online. Just a suggestion. And offline, again, the injury report and the certificate, which are supposed to be practiced offline. So with this, I will ask for your excuse. Thank you so much for giving me this opportunity to present. If you have any question, please present it in the group and we will answer you at the end of the session. Thank you.
Thank you, Dr. Satyajit. So you have explored many different options for conducting exams for different specialties, right from anatomy to forensic medicine. So let's have a little more discussion of which of these look to be feasible while we are
Yeah.
doing offline exams. So
Yes,
next I invite Dr. Anajan Adhikari,
Acha.
who's going to talk about practical assessments for phase 3, the clinical departments.
Hello, am I audible? Hello, am I
Yes,
audible?
yes, you are
Yes,
audible.
sir, audible. I'll be operating your slide, sir. So,
Thank you.
yes, sir, yes, sir, yes, sir. I'll
Arindam,
just switch
please,
off my video.
Yes, sir.
Arindam, would you please start the recording as well?
Okay, ma'am. Sure, ma'am. Yes, ma'am. Yes, sir. On your command.
Yeah, please.
Just one moment, sir. I'll just
Share
share
my
the
slide.
screen.
Yeah, excellent. Good evening, respected teachers, my dear colleagues, friends. Welcome to all of you in this sensitizing session. I was given the responsibility to sensitize you about the clinical disciplines practical examination assessment system orientation. You know, all of you, the teachers are all are innovative powers, and you are regularly innovating. Otherwise, it will be very difficult to continue the whole teaching learning system. Next slide, please. So, my objective of my presentation is just to introduce few of the issues related with conduction of practical or clinical assessment in basically the phase final MBBS examination part 1 or part 2 phase 3. Next slide, please. Yeah, we all are aware about the COVID situations, but it is also Gagandeep madam already explained that the teaching learning is going on. Teachers are continuously trying to convey the learning processes in students, but we are facing problem when we are planning to conduct the assessment. Next slide, please. Assessment, more importantly, the summative assessment. So, conduction of summative assessment is probably the most challenging part in this changing scenario. Why? Because you have to manage the facilitators or the teachers have to manage all the issues. From one hand, you have to be compatible with the guidelines like university guideline, state guideline, government of India guideline, and last the NMC guideline. Next slide, please. We have also to take care of these issues, the social distancing, hand washing, everything, the health of the students, the health of the teachers, health of the assessors also. Next slide, please. You have to design the system. Already Dr. Sanjoy explained how to manage your resources with the concept of the distancing and the good issues of managing the COVID. Next slide, please. The other very important issue related with the assessors like us is the objective of the assessment, which is very, very important. Because whenever we assess students, the first question, right, why we are assessing, what we are assessing, how we are assessing. You know, we are assessing students for understanding or getting information about their competence and their performance. It is very important summative examination because summative assessments refer to know the sum of students' learning. You know, we know about the assessment for learning, assessment of learning. Assessment for learning, I mean formative assessment, you have option, you have time, you can nurture the students. But in summative assessment, assessment of learning, you have to certify the student. You have to certify the students so the students can enter into their professional field. So it is very important. How will you manage all these facets? Next slide, please. Yeah. Using multiple points of observation, assessors can gain deeper insight into the students' abilities and have multiple opportunities to get feedback. Yes, you know, we are aware about the whole assessment system, and as if we enter into different parts of the whole system to get the overall idea about the students' performance, it provides much better feedback to us. Use of technology is very important nowadays to gather multiple evidences. You can do in different ways. The technology is
and we already started using this technology to get much information from the students. We need to ensure, this is very important, though we are taking classes online for a long time, but as far as the examination is concerned, we need to ensure that the quality of examination is maintained. Very important. Otherwise, the importance of the examinations to the students will be less, and that will create a negative impact on the whole system, education system. Next slide, please. So now I make this Miller's pyramid just to orient that always teachers are planning to evaluate, taking care of these issues. That where should I? I'll tell you later. This is Professor S.K. Ghosh. He's a reputed anatomy teacher. He's with me. So anyhow, about the Miller's pyramid, the different stages of evaluation. The knows how, shows how to design the questions, how to design the OSCEs, how to design the practical assessment. All these are related with this system. Next slide, please. Yeah. As far as the clinical examination is concerned in final assessment, these are few important points, that is long case, short case, spotting, instrument, X-ray, ECGs we used to give the students. And I'll try to give you a few points that can improve the assessment system in our colleges. Next slide, please. As far as the spotting is concerned, we can show a particular image, model, photograph. Already Satyajit explained that in a lecture theater. We can present in the screen few slides, and this can address a larger number of students. So I think there should not be a problem of the distancing problem, and then instruct the students to identify or spot the answers and write these into the answer script, so that we can allot larger number of students in this assessment process of spotting. Next slide, please. As far as the short case is concerned, in short case and long case, the two part is important in clinical assessment part. We can show students image, model, photograph, even video clips. Then can ask the student to explain the particular point, issues, and can ask the student if they draw, can explain, request them to clarify the mechanism, and that helps in the evaluation of the student's learning. Just giving one example, that showing a case of video of a pregnant woman and supporting with the features or points of important clues of antepartum hemorrhage, assessor may ask the question of APH as a short case, and this may be considered as a short case, so that students can be evaluated on these specific short case and can be given the marking system. Students can be explained, examined and explain it and answer in the answer script. Next slide, please. To replicate a real clinical patient, this is our motto in clinical examination, clinical assessment. To replicate the clinical situation, real life situation. Now, suppose video of abnormal case, video of abnormal posture, video of some form of assessment, experiment, inspection, or the photograph, whatever may be. We can some signs and symptoms that we can ask the students about the specific cases, just like here. We can just showing the gait, we can ask the students about the gait, the reason, and related question. That can be taken as a case of short case of orthopedics. Next slide, please. It's a very important issue, that's the OSCE, objective structured clinical examination. I think all we have some idea about OSCE, and we are also using this OSCE to some extent in different ways in different medical colleges. It is objective assessment of bedside clinical competence. It's very, very important, and if it can be done properly, I think you will get a lot of information of students' learning. It is a form of practical examination which is objective in nature and which owes its objectivity to structured marking system. So assessment should be will be more perfect. key concept of OSCE is to break the procedure into its component skills and assess their individually. So a larger competencies can be divided into smaller skill, and the assessor can assess on these smaller skill and can categorize the students' learning. Next slide, please. Yeah, these are few pictures showing different OSCE stations. You can evaluate the different aspects of students' learning in OSCE station. Next slide, please. Yeah, next slide, please. Encounters between students and patients for the assessment of clinical skill can also be done through OSCE. During the OSCE encounter, the learners first evaluate a case with important points like history, inspection, palpation, or auscultation. Students can be evaluated even for the communication skill, the counseling skill. At the end of the encounter, they can be given marks on the structured scoring format. Next slide, please. The OSCE station, you have to design the OSCE station properly. Yeah, and keeping your objectivity, that what exactly you're planning to assess from the information from the student. The OSCE stations may be designed in such a way that help in the assessment of clinical case. Even long test, yes, it is true that long test cannot be evaluated with any form of other replacement form, but to some extent you can get information on the long test. Even long test to some extent can be evaluated through OSCE. Photographs, images, a digital clipping on screen in a situation may assess the student's defined objectivity. A wide range of clinical knowledge can be assessed by showing the videos, all other things, photographs, models, whatever may be. Next slide, please. Yeah. Just one example. In a OSCE session, we can show some photographs of a road traffic accident. Yeah. Then we can provide also few equipments of life support there, basic life support there, and can frame the checklist in such a way that we can explore the students' learning on these issues. But whatever may be the photograph, the videograph, whatever may be used in the OSCE station, we must take care of the patient confidentiality and privacy policies. Next slide, please. Yeah, this is preparation of a clinical case scenario. I don't know how many of we are doing already. A concise clinical history with the relevant questions can be put together to make the representative clinical case scenario of disease such a way that can give clues to reach proper diagnosis and the examination setting. I know, designing just like something like problem-based learning, designing a case, a paper-based case in such a way that will drag the students towards the diagnosis, towards the history issues, towards the investigations, and ultimately the therapy, the advice, like that. Next slide. One example of this type of preparation of clinical case, just one example, a tuberculosis of hip joint in a 12 years boy with poor socioeconomic status, with a history of low birth weight, presenting with a painful limb, with right knee pain of on and off for last 5 months. There could be constitutional symptoms like loss of weight, poor appetite. Examination reveals wasting of hip, limb length discrepancies with decreased abduction, adduction, and internal rotation at the hip. Now, from these cases, we can start our viva or interaction with the students, and that can further build the question related with this problem of history taking or additional information on examination finding. Next slide, please. Yeah. So, in clinical evaluation system, the practical or clinical assessment, most important is the 3 parts, that is inspection, palpation, and examination. Yes, it is true that we can do a major chunk of the inspection part. It can be done. The inspection can be easily inferred from clinical photograph models and other things, video recording. But palpation and examination of the traditional examination system is more difficult to replicate in any other way. So it is true that we can complement to some extent the whole examination process, but not totally. It is not totally possible. In one hand, you have to follow the guideline of universities and other regulatory agencies, and the other hand, you have a research conference, you have your faculties, their ability, and also at the same time your students, how much they are exposed in the way of appearing in the examination. Next slide. So we can do some improvisation with limitations. There will be a need to ensure quality assurance of the examination system. Yes, it's very important. Whatever may be the process we are taking, or amalgamating the different parts, like some offline, some online issues, we must be very careful about the quality of examination and whether the examination quality is addressing our objectivity of assessment. And I think we can solve this issue to some extent, because it is not so much difficult to comply with these IT support, present IT support. Next slide, please. These are a few references. Next slide, please. So with this, I am ending my presentation with this expectation that we will innovate in our center according to our reality, feasibility, but taking care of the core concept of assessment. Thank you to all of you for your patient hearing. Thank you, Madam.
Thank you, Dr. Anjan. So, in the span of a few minutes, the three speakers, Dr. Sanjay, Dr. Satyajit, and Dr. Anjan, have taken us through the various aspects of conducting the offline exams. So now that the students are offline, while the whole teaching process has been online, we are now gearing up for conducting the offline examinations, and we would like to hear your comments, your suggestions on the ideas which have been put across. I see here that a couple of ideas have come in already. So Dr. Suma has mentioned that for biochemistry, you can show them instruments by projections, you can have data calculations, data interpretation. It's good to see that a lot of these more ideas have come up while we've worked through the online system. So thank you, Dr. Soma, for sharing those ideas. And then Dr. Devshmita mentioned about requiring a microscope for identification of some crystals. So let's see what the others have to say about use of microscopes, because anatomy, biochemistry, and then pathology, microbiology, all of them will have a lot of work to do with microscopes. So how can we do that safely?
Ma'am, may I say something?
Sure, please go ahead.
Yeah. Just to give you an idea about what is the major issue with using, or rather where we can actually step forward from using microscopes individually by the students to see something and then into a phase of projection. It is solely because when all of you understand, whenever they are trying to see the microscope, they will have to be very close to that instrument, and that actually creates a lot of problem of transmission of this COVID, which you already know. So to address that particular problem, I think majority of the medical colleges, for the purpose of the semester examination, they have adapted to some other measure of not using the microscope and doing it in some revised manner. So, and regarding the different topics, as told by Devashmita madam and Soma madam, madam, I think it is actually department's idea what they want to do on online and how much they want to do on online. It is something that has to be decided by the department itself. Thank you, madam.
Okay, Shamal sir has asked a very relevant question. How can we assess the domain of shows and shows how in short case through video? So, Anjan sir or ma'am, so shows and shows how domains, how can they be properly assessed via video?
Should I right?
Yes, yes, sir. Yes, sir. Yes, sir. You are.
Yeah. As far as my understanding is concerned, we can do to some extent assessment of shows and shows how through videos. Suppose look one thing. If you want to evaluate whether the student is able to examine a patient of suppose malnutrition. Yeah, it is not possible exactly to evaluate whatever we are doing previously. Now you can provide a photograph, number of photographs, and you can tell the students to identify one photograph of those which shows malnutrition in the child. You can then drag why the other photographs are not identified as a malnutrition. Then what may be the point of identifying this photograph as a malnourished child? You can drag the questions in such a scenario in consequences that ultimately clarify that the learner have some idea, even for shows how is also you can also demonstrate some procedures and can ask the students to identify whether this procedure is right or wrong, whether the steps of the procedure is right or wrong. If wrong, what can be done? Like that, we can do to some extent, madam.
To add to what Dr. Anjan said, ideally speaking, you would not be able to assess shows and shows how by showing a video. You can assess the knowledge, as you said, steps. Yes, the student will be able to, at undergraduate level, you would not be assessing so much on steps. But even if it's a postgraduate student, you would be able to, okay, the student may be able to say that these are the things which were missed. But that is really about knowledge. It's not going up to saying shows and shows how. That would ideally need you to work up the patient, be on the bedside, and then we will be able to do it. So if we have, right now we have a lot of concern about COVID. So there will be to some extent compromises. There have been compromises even while we were teaching. So right now we're talking about assessment, but if we think about the whole year, there has been some compromise on the practical teaching as well. So we tried to make up for it while the students came back, and we did conduct some off-site classes for them, call them to the labs in different departments. But shows and shows how is going to be a little difficult with the current scenario if we are going to use just a video.
I would like to add Dr. Pansy Lyle. I know most of you already know her. Already gave a very interesting answer. In her institute, she actually assessed shows how. She has written in the chat box, as you all can read. Students were asked to record videos at home, and then they actually send that video to the examiners, and that was a very good way to assess shows how actually.
With due permission, for that shows how, ma'am, is it possible that we do this entire event, whatever a student is doing, supposedly a student is examining the liver, and that entire thing is getting recorded, and then that is being shared with the examiner?
Would any of the participants like to respond?
Yeah, Dr.
before I go?
Pansy Lyle has already answered it in the chat box. Most of you already know her. She, in her institute, she actually assessed it in the exact way that Dr. Satyajit has told. Shows how was assessed, where the students actually recorded videos at home, and those videos were sent to the examiner.
Oh, yeah.
Satyajit,
Yes, sir.
these type of assessments, what you are speaking, is already started in Western world.
Yes, sir.
Even they started virtual round in clinics. Where the students is not at the place, the faculty is not in the place. By virtually, both the faculties and the students are attending the patient.
Yes.
And the faculties are teaching the patient. So whatever you are telling, yes, it can be done. Can be done.
Dr. Bakchi has raised a question of whether these alternative methods of practical examinations are applicable to the postgraduate courses as well. Dr. Bakchi, the postgraduate exams in fact were conducted last year. For our university, they went on as usual. So a lot of mix and match, as we've been talking about, was done. Some of the examiners insisted that there should be real patients. They were actually tested for COVID, while other examiners used some case-based scenarios. So instead of making the postgraduates work up all the short and the long cases, so they actually said, okay, we will use a combination of both. So a lot of innovative methods have been used even for postgraduate examinations as well. We just have to make sure that these are aligned with their competencies, and I'm sure most of these are also applicable there as well.
One question from Dr. Showman: how to address palpation, percussion, auscultation as a part of clinical examination in online system? And I think Skill Lab is an answer to that. Dr. Pansy has replied. High fidelity mannequins, but
see, those are good ideas, and all of us are working towards getting our skill labs in place. But there's one thing that we all need to remember, that when we are introducing these assessment methods, we also need to think about how we have taught all this. What are the teaching methods that we have used? So it's a good idea to explore all these assessment methods, but we must remember that the students need to be sensitized about these assessment procedures that we are planning to be using. So if we haven't done OSCEs at all and suddenly we want to do OSCEs, it's not really fair to the students. So yes, we do need alternative options to explore, but at the same time, I do know that many of us have used these alternatives even to conduct our formative assessments. So for example, when we've conducted our final term exams and other term exams, so as Dr. Pansy and Dr. Soma, they have shared their ideas of what they have done. So the students are aware. So it is important for the students to know that this is how we will be assessed. So it's a good idea to look at a lot of new methods, but if we haven't used them earlier, it's going to need some training on our part to become good at it. And also the students also need to know how they will be assessed.
Gagandeep, madam.
Yes, Dr. Anjan.
Yeah. I think it is the responsibility of the faculties to sensitize even through online what should be the mode of examination. I mean, assessment process. Otherwise, it will be very difficult for the learners to catch up because they are generally scared about examination.
Yes, that's the precise reason I said that before they have these university exams, they do need to know what their exam pattern in each of these subjects is going to be like. I go back to one comment from Dr. Pansy, who's mentioned that you can use projection of slides. That is something, yes, that most of these specialties who need to use microscope can do that. And I see a very pertinent comment here. When you want to see how well can the student focus the microscope, that is where you need the real microscope and to handle it. But yes, there are safety concerns with the use of microscopes. So that is where we need to explore options. And yes, projection of slides where the student needs to interpret, that's an option that we can be exploring for many of these specialties.
So if we are done with the open house question answer session, okay, there's one question. There actually one comment and suggestion by Professor Ashita Debra. In this era of digitalization, we can always use microscope which use tabs in place of eyepieces, reduces contact. Naturally, the whole viewfinder will be projected in a giant screen instead of putting the eye through the microscope.
Dr. Arindam, are you there?
Yes, ma'am, I am there. My connection suddenly just froze. I don't know why.
Okay.
Ma'am, I think we are done with the question answer session. So, would you like to add anything, ma'am? And then we'll hand over to Partho sir for the final comment and vote of thanks.
Thank you, Dr. Arindam. Just a couple of comments from my side that Dr. Sanjay had highlighted that this is the time that we need to have our guidelines in place. So we need to see what the university recommends, what are the guidelines that are there for maintaining all precautions for COVID-19. This also calls for a lot of planning for assessment. So yes, we do plan for our university exams, but this particular time calls for even more planning and arranging the logistics for conducting the exams, because the exams will go on for multiple days. You will have different batches of students coming in. So how many students will you place in a particular room? When they move from one place to the other, where do they go? So a lot of logistics need to be planned at this time so that we can conduct our exams well. We at the same time don't really want to compromise on the quality, and that is why we are all exploring these innovative ideas as to how to assess the students' competence while maintaining all the precautions. So let's share some more ideas as they come up and share the good practices so that we can all collaborate and assess our students well. Thank you.
All right, thanks a lot, ma'am, for your inputs. Partho sir, Professor Parthapratim Pradhan.
Thank you.
Sir, now
Thank
over
you,
to
Arindam,
you. Full
for
and finally
conducting
over
such a
to you, sir.
It's full your support, your
Our
help,
think tank.
your energy. Oh, thanks to you.
So few words from my side from the table of Medical Educators Society of India, MESI, and thanks to the coordinator Dr. Arindam and the speakers Dr. Anajan, Dr. Sanjoy, Dr. Satyajit, and of course our ma'am as moderator Gagandeep ma'am, and lastly the esteemed speaker as participants who participated today and make the program successful. Actually, there are several good and innovative practices conducted by different faculties of many institutions throughout the not only for your presence and of course the speakers and Gagandeep madam and Arindam really has done a great job within a few days of notice. So I think all of us enjoyed this program, and actually what is the essence? There must be a hybridization of offline and online. Satyajit, in the slides of Satyajit, it is a very clear-cut demarcated the SWOT analysis of each type of online and offline classes and assessment. So I think within 1 month we will meet again, and I again request all the members, non-members, faculties of MESI to join our hands so that we can share our best practices with others. Thank you all, and thank you. Good.
Thank you, sir. Thank you, everyone.
Thank you, sir. Thank you, everyone. Thank you so much. Thank you, madam.
Thank you very much. Thanks, everybody. Thanks, Dr. Gagandeep, for guiding all of us, in fact, and moderating the sessions.
And I'm happy to have this opportunity, and I'm grateful for it to coordinate this session. Thank you.
Thanks.
Okay. Bye everyone.
Bye everybody. Thank you.
Bye. Thank you.
Converted. Ee baba, hi. আরে আমি এই যে কথাগুলো বলছি এগুলোতে বা রেকর্ড হচ্ছে